Yes, you're welcome to this second session of our topic of discussion. And we are with our good guest. I add that one because you respected, you honored our invitation, the Honorable NAMUGGA GORRETH, the MP MAWOGOLA County, Matete constituency. And that is in Sembabule district, all that which neighbors Masaka district. And dear viewers of Smart 24 TV, I remain Dr. Joseph Tindiyebwa, going through the discussion together in this POLICON program. We continue to look at, does the current state of national health and environment sector performance be of effect to the economic livelihood of the people? Smart 24 TV drives business, but today, in our POLICON program, we realize that if we don't have good health, we cannot raise wealth. And it is a concern in our discussion as we talk about environment, environmental health. We are supposed to have a preservance of good air that like Uganda is gifted with. But unfortunately, there are a number of occurrences that are related to climate change that is a threat even to our good air that we are expected to breathe without buying. And we are supposed to be having access to water. That is part of the environment. Access to water, hygienic water, and also good sanitation. Honorable, as we were going into our break, there was a concern to look at the state of our health sector in MAWOGOLA there, Sembabule, Masaka, northern Uganda. We continue to western Uganda, central Uganda. The citizens are still with an outcry, especially of realizing equitable health provision. You've mentioned a number of strategies how this can be resolved. But the citizens also are expected, indeed, you also articulated on that, to know their corporate responsibility. Or now they are supposed to ensure that they do body checkup, but I have seen this once in a while because they don't have that ability, where some of the members of parliament, we appreciate some of you, because it's not your role at first to be taking health camps. And the role of the government and the civil society to encourage health camps, it looks to be optional. Yet of recent, when I was in our constituency, I was looking it to be very much important. One of that policy, the policy of health camp, to survey, to know which diseases, either, the state of health of the people. We are always working, but all of us, in most cases, because of the failure of this service, you find that you go to cure, or you are going for a medication after you're already out, your state of health is already out of control. And the existing policy is not emphasizing this. I'm emphasizing on this maybe in the future. I'm trusting by having you is a blessing. You may bring it before the parliamentary floor either as a matter of national concern. In states like, developed countries like America, there is a friend of mine who gave me the story of what happens to ensure that people remain in good health. The health screening, periodic. Every month it is mandatory. And we ask ourselves, is it that because Uganda, much as there is stealing of money, there is that one is a known story. We cannot fail to talk about it, stealing of public resources. Is it impossible that we cannot do to know the health screening? Because some of our people are dying of cancer, honorable. The concern to the viewers and ourselves is that by the time you go to realize the sickness you have, the money which you have spent 10 years working, my friend, either here or there, you've spent 2 years working for maybe per month being paid 500,000, and all of a sudden, because you didn't know the state of your health, you find that you have a sickness, and within one day, all the money is lost. That's the concern we are bringing in our discussion, that finally, it instead of reducing poverty, it increases poverty. What is your encouragement and inspiration in this so that it can be either the possibility of being achievable in order to keep a healthy population?
Actually, it's a very good question. As legislators or as leaders, we should stop, we should stop doing things as a formality, or stop doing things for fashion. For example, you will have the health center 3s, health center 2s, but how many of those, because that is the nearest health facility by government, whether private has, you know, because private gives additional service. If you go to health center 2s, wherever they are, do they have these basic machines? Because say if it's a policy and that after 2 months, 3 months, or on a quarterly basis, which is 3 months, somebody should go for a medical review. How can we access it for free? Where can somebody go freely to be checked normally? You know, diabetes, yeah, pressure. Yes, normal checking. How many times? I mean, how many of those facilities are available to give that basic service? You know, currently we have VHTs at village levels. When I went to the VHTs in my area, I asked them, what have you been given to at least cater for the basics? You know, they have a first aid box. I asked them, what do you have in that first aid box? They have Panadol, they have gloves, Panadol and gloves basically. Then I asked, what is the importance of having these VHTs if it's not for fashion? Because I would assume that a VHT would have a BP machine, those first basics, because the assumption is these are trained medical personnel, but at a lower level. Somebody is, at least has ever been trained in the area of at least a nurse, a health worker, anything. Because we have old people 60 and above who need to have those BP machines that, you know, for pressure, for diabetes. If we had the VHTs equipped with those ones, don't you think it would be a service, at least for somebody over the weekend to call? You know, they have those village trees where they sit every weekend. If those VHTs were given some of those small equipments, at least to say every Sunday, they can help those old people to, you know, at least for that basic services. You know, it is a very big service by leaders. You know, basically leaders of a high profile, I know they do those checkups. So if you find out that they are important to you, then why not to a common Ugandan? Why not? So I think we should also learn to love our country. As we do the planning, you also think about others. The way you want to take care of your health is the way we should think of other people. You know, I'm telling you, high profile people are insured. They are insured, they go for free, they get free medication. So if you can get free medication, why don't you think about the common person? Because if you feel the pinch of paying 100,000 after your daughter has been given medical attention in a hospital, why don't you feel the same pain of the person who is paying 20,000? You look at the women in our villages, no scans, basically no scans in those health center 3s. Somebody must go to Masaka Regional Referral Hospital for scanning. Women in villages give birth without, you know, any scan because it is 30,000. How many can afford to take 3 or even 2 scans in, you know, during the period of the 9-month pregnancy? So we fail to do the basics. But I'm telling you, this can be done. If you can look at, it was the financial, Otageno's report, financial year 2019-20, where 8 billion was lost in corruption. 8 billion. So I think it all comes back to us as Ugandans. You cannot teach people to love their country. These things are doable, we can do them, but it's a matter of, you know, appropriation. We give priority, and let us give a service wholeheartedly. These things are possible and they can be done. Lastly, health camps. Do you think it's hard for government that has that health center 3 locally to at least put, you know, you can do it also on a quarterly basis, that every month we should be moving out, having those health clinics. To
go with the machines, and they know we are in this constituency.
If you can take the parish model to a parish level. Parish model, parish. Why don't you think that it is very paramount and important to go down to the ground and give health services? You know, it is not mandatory that it should be, you know, that it should be routine, but at least set a time for people to know that during this month in a year, we expect this at this, you know, hospital or at this place.
We need to take it up so that it can be a matter of policy, because
I think we should.
We shall be grateful if we hear that now there is a matter of national importance for the screening of, improving the state of health in Uganda, so that there can be that unit, the mobile unit, that is guaranteed in a district, each district, because you have decentralization, to know that in a district there's a mobile unit that will do the cross-checking, the screening of the health status of the people.
And actually, do you know the importance of that? Yes. It helps government in future planning.
Exactly.
Where do you put resources next financial year?
Exactly.
These reports will give a direction on where to invest.
Exactly.
Reason as to why we are losing money in several nugatory investments is because we don't have research.
Exactly.
We don't have data. You find government investing where it is not necessary.
Exactly. Dear viewers, this is an interesting discussion. We are saying from the guest and agreeing with her, and you also with some views, that if we are to improve the state of health in this country, a number of initiatives she has proposed them there. Some of them, she's going to take them up even before the parliamentary floor. I hope so. And looking at the importance of research, health and research is also pertinent in our country. She has emphasized on appropriation of funds. She's again keen, she developed a keen interest that why should the government not take priority into the health sector, and yet it is where the people can be able to benefit much. We are continuing with our discussion. We do not separate at all the need to preserve our environment. And environment is also a contributory factor to good health, and above all, with environment as a sector, if the environment is conserved very well, we are assured of utilizing our natural resources profitably that can improve the economic livelihoods of the people. And in our communities, Honorable and the viewers, it is known that there is an encouragement of people forming circles. But these circles, they only focus on, this is Saturday, we are going to meet, we pay 10,000, because we are dealing with the economic lives of the people. But we are not seeing the community, again, I don't know in MAWOGOLA, but I'm referring to my community. What they tried a bit and which needed support is by having their groups, which they used to say, the Bataka, let us help ourselves, development groups. But I was not a bit comfortable with the groupings, because the target at first was looking at when a person dies. But for us here in our situation, as we discuss with you, we want to agree with you and come with views together. While you are still alive, how have you accumulated your wealth? Number one, ensuring good health. Number two, your environment, because environment contributes also to good health. If we are having a dirty city in terms of the environment health, that means we are prone to attract diseases. These waterborne diseases and many more others. The banning of these paper bags, Buvera, is not yet finished. The policy about cars, which are imported in Uganda, we still open up for the utilization of vehicles in Uganda. And yet, the viewers, as we come to inform and teach, and the Honorable, you will maybe give us hope, it looks to be, it is also contributing to cancer. These vehicles which doesn't have a limit of utilization because of the smoke, too much carbon they produce, and yet it looks to be the government is silent on this. How best can we improve on the health status of the people, but by preserving the environment?
The last statement, the government is silent. The government is silent. What are you doing as a citizen? You know, the most important aspect that is killing this country is attitude of the citizens. Everything comes back to government. The government is overburdened. That is the fact. The solution always begins with you as the first user. If you take water wherever you are, where do you dispose of this tin? As you go to the supermarket to buy whatever you are buying, where are you putting the Buvera?
But
yes, I believe.
One second. But like here in Kampala, I saw it in Kigali. I used to go there for lecturing. They made it mandatory. You don't finish 5 kilometers in the environment. I mean 5 meters, 10 meters without a dustbin. And again, you attempt to throw it away, you will pay heavy fine.
I tell you, as a country, we are indisciplined as citizens. When it comes to dustbins, I've told you I've been in a local government. Are you aware that people steal them, the metal ones? Are you aware that they are, you know, wherever you look at Kampala during Jennifer's time, She used to bring several alternatives. There are those cans that, you know, the ones that were swinging, they come and, you know, pick the garbage. Then, you know, people steal them. Then they resorted to those of concrete.
Concrete,
yes. But also picking out the garbage is not easy. So as Ugandans, what should we do on issues of environment? First of all, we should appreciate it all begins with us. Government, policy, the laws, enforcement is very poor. Because, you know, me, I feel so bad when somebody, you know, tells me about learning from Rwanda. It is true, you can learn from anywhere. But really, Rwanda, everything, you know, Rwanda has become a point of reference on almost everything. What are they doing that
it's not only me who have said it.
Yes, these have become everything you do Rwanda. Cleanness, smart city, go to Rwanda. Smart city, you go to Kigali and you see how a smart city looks like.
You can't throw this bottle anywhere.
You can't.
You can't. Even
but remember, Jennifer's time. Jennifer's time, you know, I was passing through, it was the old park. New park, I was going to Masaka. Someone came and he was taking these sugar canes and threw a kavera. You know, guys near a beat that person up. Jennifer's had instilled that in people of Kampala. Don't just litter.
Can't we have
don't
it
just litter.
And we don't put in politics.
Yes.
We just
why
do
have
it.
We? No, why don't we have that spirit now?
Yes, yes.
I think it comes back to leadership. You know, Jennifer was very frustrated when the president mentioned that I would have won with a big percentage in Kampala, but it was because of Jennifer. The lady lost interest. People may think that Jennifer's contract ended and she went. It was such a big statement for Jennifer. What does it mean? At times, politics needs to be put aside for you if you are to enforce laws. You know, at times we look too much into how can I win their hearts when it comes to voting. But totally when you are affecting what they are supposed to do. Environment, wetlands, the persons who own plots in wetlands of Kampala are the rich. But you know the bit about it? They've constructed buildings and they've fallen.
But why can't you have, using at least the platform of Parliament, to have, you know, I used to have, when I was working in the Parliament, especially the field visits, to do field visits tours into these areas where they have degraded the environment. You go there, you make report, you take them to IGG, they dismantle so that we can have a reinstatement of our environment.
Doctor, do you know how many reports you have on table unimplemented? Do you know those that you want to tell me that all the reports that were done on wetlands of Kampala are already implemented? You know, we have a challenge of enforcement, conflict of interest. We have those big shots who cannot. Remember Jennifer's time when they started, you know, when they started demolishing buildings. You remember that time? Jennifer had become too tough.
But that was a bit good.
Yes, but what happened to her? Do you think Dorothy can do the same? If really you get the history of how your colleague left.
If she's if she's not working, you can cause for an audit of abuse of office if she's not working.
You know, dear viewers,
because she must work.
Huh? No,
she must work.
No, but there is a lot to do.
And you know she's being paid, is it 50 million per month?
No, doctor, 50 million wouldn't be the issue.
45 million.
50 million wouldn't be the issue. But she has a lot to do that. You know, it very much hurts. You saw how this, the RCS of Kampala who was taken to wherever he was taken. After putting Kampala to order, please leave. Do you know that people of Kampala celebrated after his, after his transfer? So I think it should all come back to objectivity as we offer service. Ugandans should know that you cannot have a freelance country where everyone is at liberty to do whatever they want at any time. We must have laws. Because, you know, look at how the matters of urgent importance on the floor of Parliament about heavy rains, hailstorms. I'm telling you, we are here in Kampala talking about Buvera. We've lost property in villages. Houses have fallen down. Plantations have been spoiled. And the Ministry of Disaster is suffering with so many requests on table. I was with the Honorable Minister Nyakun. I told her my sister have so far had 4 disasters in my area, 4 houses down. And you know what happens? Government brings posho and beans where it has given. Then how do you look at this guy whose house was put down? Here you ask somebody has nowhere to sleep, you are bringing beans. So the issue of the environment is even beyond the Kavera. We've cut down the trees, the wetlands, you know, the lake. We are disposing of anything that we can afford to dispose within the lake. So right from the water we take,
Yes.
from the, are you aware that people have even started fearing taking fish? And the most nutritious meal on planet
And
Earth.
it is referred to be having some chemicals.
Yes, the most nutritious. People fear to take fish because the lakes have been, you know, emissions, everything is poured into the lakes. So as a country, we have a lot to do when it comes to environment. And there are two things that are seriously hitting Uganda as a country. That is corruption and environment change. If we don't come up in arms to look at those two, the country is gone.
What are you attempting to do? Because we are a bit in a dilemma. Me, if like you beat me, I go to the police. So because I don't know how to fight very well, so to save myself, and again, I'm not supposed to. So in this case, the citizens, they can feel when you see petitions, and some you had recommended them that if maybe petitions are not worked on, you had said that they should start a new dimension, maybe to express their displeasure. And having said that, we were looking at the challenge, and of which we share with those who are viewing us, so that you can also be part of the societal transformational agenda. When we are talking about this, you know, failure to enforce the law of, for instance, managing these disposables, you are talking about Buvera. In most cases, if you have traversed through the city during the time of floods within the city, these channels, water channels, are always blocked by Buvera and these bottles. These are disposable bottles. And yet, the government continues to pay a lot of money to remove. But the government is not committing to implement even the law about Buvera. Do you think this norm should stay like this, or we can do better than this? Because it has effect on the economy, in the economic livelihoods of the people. If people are sick, they cannot make money. And again, if our environment is totally degraded, we will always go back to the psycholic poverty. Some people think that the psycholic poverty is when people are not working. But the psycholic poverty, which would like the viewers to understand our discussion, also is when there is limited change to the lifestyle, behavioral lifestyle of the citizen. What is your take on that?
You've talked about health. You know, productivity automatically affects the economy, and it turns to extravagance and nugatory expenditure. You know, when it comes to nugatory, irrelevant in all aspects, even up to a personal level. For example, if you are not productive, automatically the economy is affected because you pay taxes. Every day you don't work, government loses, meaning a productive citizen is an asset to a country. What does it mean? If you are sick, the government is at loss. So it means it would be in the best of our interest as leaders to have a health population. But when it gets back to you also, you know that whenever you are sick and you are non-productive, all the money you make will be taken to hospitals. Is an hospital an investment? Does it bring returns to you as a person? So what does it mean? It comes back to all of us. What should you do? What should government do? Number one, as citizens, because already we have enabling laws. And when I was talking to Right Honorable Minister Mabida, what's her name? The Mama Mabida, Beta Anua. She said, you know, we are trying, but enforcement. Then I asked her, if it's enforcement.
Didn't you ask her she used to demonstrate why she
Actually, I said, Mama Bida.
She used to demonstrate, that's why she was called Mama Bida.
The moral authority to really speak to Ugandans by you as the minister, it reduced because people thought you were very active the other time. But now you've ceased to talk about some of these things objectively. So, you know, but even when you talk about enforcement is money.
Yeah, the government should be committed to do so.
Yes.
If they can pay to take soldiers to Congo, why not pay for the enforcement?
What am I saying? It is our duty as citizens to change attitude. And they will look at things. Though, sometime back when they were implementing the Kavera issue, they said it was a story that, you know, they are waiting, there are businessmen and women who had imported Buvera, and they're waiting for them to sell. After they are done, you know, we shall close business. I don't know whether you also had such a story.
Yes, I heard
like,
about the story.
So we thought, I asked myself, Where have we failed on implementation of the Kavera policy? Where have we failed? Because remember that time, paper bags had become paper bags in villages. They had told us to use banana leaves. And we had started. You could go to a butcher and we had, by the way, gotten market. For the banana leaves, my women in the villages could cut banana leaves and take to the trading center.
And others we're now investing in art and crafts.
Good.
These ones, and which are very good.
And which are very good. Now we are asking.
Then another country, they use these envelopes which are manufactured out of, you know, wood.
And paper.
Envelopes.
You know?
Paper.
So, and we are asking the ministry, what has gone wrong? You mean Ugandans, where do we buy buveras? They are the ones who import them in. Why don't you stop the importation of buvera? Because
who are they imported? Who is the owner of the factory that manufactures buvera?
The owner of the factory, I cannot be here to start, you know, personalizing people's businesses.
Yes.
But the best is, it is their businesses. People don't want to forfeit business. You remember one time they said they are the macro, yes, money, you know, buveras, it was 0.2
they
something.
Contribute to taxes.
They were talking about the macro, the thin, it should not, about the Kavera itself, that there is those that if made, they cannot affect, and there are those, there was a scientific reasoning. Then we said, why do you go into that science? Let us ban Kavera. If you ban Kavera, there is no good Kavera. That was our reasoning. Why then a good Kavera? Where is a good Kavera? But because people think it's their business, I mean, they are trying to favor colleagues who have invested a lot in some of those businesses. But government can see how to you know, come in to...
Will you talk to your colleagues so that we can really see that happening again? We'll be happy with your team. Because the law is in place and it's not being
implementation is the challenge, and they also admit. But then we are asking, I've told you as the opposition, we cannot do it alone. Yeah. How can we have citizens on board? Buvera. So, and because if we look at those who own business of Buvera and us the users, who are the big in numbers, we are more than the owners of the businesses. So if Kavera is bad, why? And people have, you know, to the extent of using Buvera to cook food.
Yes, yeah.
And it is a health hazard.
And it's cancerous. It is a cause of cancer.
Because
using
government would have come up to explain to Ugandans why is cancer rampant nowadays. Because why do we have many patients in the Cancer Institute? These are the things. These are the things. But, you know, right from Buvera, right from, I mean, back to these machines machines that ground nuts, grounding machines. So, you know, government, I think, you know, people will take government to court in the future. When you get a smart citizen, government will pay heavily to those Ugandans that have gotten health issues as a result of the environment.
Of not paying, you know, implementing the law.
Because, have the citizens, why can't we stop the production of Buvera?
Here is a question, Madam Honorable. Your youth, Ugandan youth, not only your youth, you know, you are a member of parliament for the whole of Uganda. They could desire to have jobs. And it is still the cry of many. Yet, at the same time, we are having a dilemma of where the investors are coming and occupying wetlands, growing rice in the wetlands, and at the same time saying that we want to preserve the wetlands. Constructing hospitals, industries in the wetlands, at the same time when they're saying, we should preserve our wetlands. What do you think should be thoroughly well planned for to end this dilemma? Because we want to earn, but we are having a situation where the earning is being made difficult, again, because there is a need to preserve the environment. What should be done best?
The advantage that we have with Uganda, we have experts in almost every field. When it comes to issues of the environment, you've traveled to countries where buildings are constructed with columns, and the water is, you know, the water remains, you know, moving down.
So coexistence.
Yeah, it's coexistence. When you go to Busega, when those columns were put for a flyover, did it affect the swamp? Why can't we resort to coexistence. How can we exist? Because,
we
because of
maintain
the growth in population, land is becoming scarce. How can we smartly use land, optimally use land, and at the same time without affecting the environment? Can we see constructed buildings up, but when water, you know, and other features, you know, can we reach that level? Do you think we cannot get there? You saw, you know, people were complaining about some towns where we have, I mean, they have not started this business of constructing storage buildings. You find so many of people constructing these normal ones. How do you call them technically in engineering language? You know, you say land is scarce. At least we should be, you know, upward.
Yeah, to use the space up.
To use the space up. So we are asking, do you think totally eliminating wetlands is the solution? Do you think that can be a solution? Why can't we look for technicalities of existing?
Coexisting.
Coexisting. So, you know, when you go to this around, which place is that? Kawala, which Lubiji, the Lubiji wetland. When you look at Lubiji and the way it is seriously being encroached,
they are constructing on it.
And fun enough, when it rains, you can see the you know, Lubiji houses. People seriously suffer when it rains, and you ask, is there somebody who has ever opted to build a house, and at the end of the day, when it rains in the night, you keep standing in your own house? So why don't we ask environment experts, how can we ensure that as we make use of the space that we have,
the national
environment, so as we make use of the space, how can we coexist? If not, how do we remain safe environmentally? Because you were the one who was talking about pollution, and people may take it for granted. But you know, for those who have stayed up country, you cannot admire keeping in Kampala. Staying in Kampala, it is not admirable at all. Very congested, and these days people were like, you know, whoever goes through Kampala, like, you know, at least because of the hawkers off the road, at least Kampala now somebody can freely do shopping. But still, that can be taken to the environment. How do we reduce that suffocation? How do we coexist it? I've told you, degradation, climate change. Do you know why these days the cost of doing business is high? The cost of production in every aspect of business is high. It is because it is becoming expensive to purchase every unit. Because when you go to the market to buy food, or if you go to a restaurant to buy food, somebody will tell you, so food, the other time a plate was at 4,000, now it is 10,000. Why? Matoke is expensive. No rain in the villages. No rain. So the environmental impact comes back to the health issues. You will not afford to eat well because everything is expensive in the market. You cannot afford to buy. That's where we are going. Cut the forests. You deplete the, constructing wetlands. At the end of the day, you will fail to get what to eat because you cannot afford it. And
again, you have an environment which is prone to, you know, public health requirement of good.
Definitely, that is where we are going. You no longer have safe water.
Yes.
The air you breathe, you know. So everything is becoming, you know, infected and affected. So what do we do as a country? That's what I told you. Why, much as I was not in for mindset change and sensitization, it's not because I don't see the impact of sensitizing people. As like, let's use the money that we have already, the little that we have within our lines in the budget for the respective departments and agencies, to sensitize our own. But remember, you as government, you have a role to play. What have you done? Who are those that have constructed in the wetlands? It is us, the big shots in the country.
Honorable, we look at the environment. Recently, as we come to the closure of our program, we are having something admirable that the parliament matters you debated about, but was not concretely analyzed, of where Uganda, especially our citizens, who have the talent of using the traditional medical herbs, who are professional, but at the same time, who are using the environment in terms of course, that they're herbal. going into the research into the herbal medicine. And yet the herbal medicine is not being supported in our country. Do you think there is something admirable in your own view that we should admire by supporting the medical herbals in a way that will help us, number one, give jobs to our natives who are having that talent? I'm talking of those who are certified medical herbalists, because that's where we're having a professor from Mbarara University who had a challenge with the COVIDex. What is your take on that, especially in terms of taking to level policy?
The Ministry of Science, Innovation and Technology, actually all these were under Musenero. Though that office was politicized. Government saw it, it deemed it relevant, necessary, to have the ministry taken to the office of the president under presidency. Innovation is one of the areas, we've shifted from sector planning to program planning, that is budgeting. And innovation is one of the areas where government intends to put money. And when you talk about the herbalists and what they do, they fall under innovation. There are so many Ugandans who have done something, and really it's a matter of supporting them. You have the semi-phones, you have these Kayola buses. They have a lot. We have this PBD program, the banana crisps under the ministry. Science and technology has a lot that is doing, though it is not publicized. People don't know what is taking place. I think it's a matter of commitment. We need to commit more, rather than frustrating fellow Ugandans who have come up with such innovations. We have standards. We have departments that are in charge of ensuring that whatever is done fulfills the standards of this country. So I think as legislators, we need to look into how to protect the innovators of this country. When you talk about export substitution, there is no way you will do exports without producing. Because
we have, for instance, the Chinese. There are some of the centers in the city where they are importing their drugs. I call it the herbal medicine, and they are getting money. But for us, our country, we are not spending. Even when you hear the budget being read, apart from when Professor Musen was talked about. But there are others who are not at the level of a professor. And by the way, what is interesting, to be a medical herbalist, you don't need to be a professor. True. There are those who have just they have their knowledge, and which is very certified knowledge, which doesn't connect with any other kind of maybe innovating by use of either maybe consulting this and that, and they are sure, but they are not being supported. I raised it as a point of concern, and maybe with time it is an area which, in terms of improving the health status of this country, needs to be looked at. One time I met one, and they were very much concerned on how best we can achieve it. So we will also go to these conclusive either maybe points, and especially realizing the state of good health of our country. Health centers are constructed. Others, they are not yet constructed. Others are not yet upgraded. You have talked about it, with much concern, where the appropriation of funds is not taken care of. But when we reach to another year, remember, the good thing you are aware of a program, the vision of the country, Vision 2040, to have a prosperous industrial economy. Do you think, as we come to the closure and giving hope to Ugandans, whether we shall realize it, yet we are still facing these challenges? And finally, as you conclude, what should be done, and maybe what you are committed to do as an honorable member of Parliament of MAWOGOLA County? And in the meantime, we will be waiting to hear good results.
Actually, when it comes to implementation of government programs, there has been a slow progress. You remember in planning, you had the NDP 1, NDP 2, now NDP 3. Has there ever been an assessment on how far progressive, for example, how far did you achieve the NDP 1 that feeds in the NDP 3? or two. The other time we were with the National Planning Authority, and we asked them, have you ever done an evaluation of what did we plan this year that wasn't done, and how does it, yes.
They quantify, they say we achieved maybe this percentage, good.
And how does it feed into the next year?
Yes.
We have a challenge in this country of copy and paste when it comes to planning. And when I asked the executive director, NPA, that are you comfortable with having plans non-implemented and your contract is renewed year by year? How do you feel as a professional? Because I look at this as a doctor who goes to the theater and you operate people, as you operate they die, then you come back and operate another one. Do you feel comfortable as a professional? So as a country, yes, we have issues on the planning bit of it, but do we do an assessment of why haven't we achieved? And instead of dropping, you know, we have issues of you plan to do this year, it is not done, and it is not carried on in the next financial year, you automatically drop it and, you know, move on with something else. You saw us complaining about the supplementary budgets as the 11th Parliament. We asked the Honourable Minister, why supplementary? Because whenever you see a supplementary budget, that is an indicator of poor planning. And remember that supplementary came in the first quarter of a financial year. So we asked, yes. So we asked, why supplementary now? The whole thing comes back to us as planners. If we have the tools in place, where have we gone wrong? Because if you, you know, before you talk about scarcity of resources, how best have you utilized the little that you have? Districts without health centers, those with health center 2 and 3, no medicines, no medical workers. What can we do as a country? Let's look at, first of all, providing the basics as of now. Next financial year in the budget, let's ensure that we have drugs in all government health centers. If we don't have, what can we do? Because, you know, at the end of the day, you cannot talk about upgrading, yet the little you have cannot be satisfied. We faced a challenge when we came to the elders, 80 years, that 25,000 payment to those above 80. There was a proposal by the committee to have the age reduced to 25, I mean to 75. We told them, you know, as you reduce the age, the numbers go up. You failed to pay those of 80, and you want us to also drop to 75. So if it's not a political move, really, don't go into such things. Why do I bring in this? Let's stop operating political budgets. Political budgets are very dangerous to this country. At the end of the day, you end up frustrating the whole system. Let us be realistic and plan for what we can do. And let's look forward to fighting corruption wholesomely as Ugandans. You know, whether it is you taking the bribe or it is you giving, we are all affected in one way or the other. With corruption, I'm telling you, you're not going to do much. We have those medical workers of ours who go to the stores of government and bring drugs, take them to their personal pharmacies and sell them. Next time it will be your own relative, because you may be working in Kampala. They take your relative to Masaka Regional Referral Hospital. As you steal drugs from Lago, somebody else will be stealing drugs from Masaka. What will happen? Your own will go to that hospital and you will find no. Then we talked about the issue of electricity. You find government hospitals without electricity. And why do we have electricity on and off in hospitals? Have you ever lost a patient? Yes.
That can accelerate death,
yes.
and all that.
So those are things we should look at. Because if a president is home, can have electricity, 24 hours. If it there happens and electricity is off in the home of a president, I'm telling you, it's criminal to whoever's done it.
It's prison.
Yes. Why not to a hospital? So those are things we should look at.
Yes.
There are so many things that can be done, and I'm telling you, we cannot say that all can be cleared once, but we should have a standard.
The basics.
The basics. What can we do as Ugandans to have basic health care?
Thank you. Thank you so much, dear viewers, as we draw close toward the end of our program, and about to hear the last word by the Honorable, Member of Parliament, and we are pleased that we have gone through this talk show together. And Honorable NAMUGGA GORRETH, the MP MAWOGOLA County, these are leaders who are giving us hope, the realistic point of view and facts of how best we can live in a better improved country. And as I welcome you to just say your last word to the viewers, and possibly you send your greeting to your members, I mean your citizens whom you represent, and generally the countrymen and women, we would like to hear your word, Honorable.
Basically, as we conclude this program, I first of all want to thank you, Smart 24 TV, for hosting me today and all the Ugandans who have been viewing this program. Governance, leadership is very important for any country to move forward. That's why the biggest component of our budget actually is under governance and security. Those two are very important because leadership drives everything. But still it comes back to us as citizens. This is our country. So we should work together to ensure that, we move as a country. As you showed dissatisfaction of what government has not done, have you ever sat down to think about what you've not done? It brings us back to the Constitution. It is mandatory for government to have these constitutions in schools, for citizens to know their basics. What is your responsibility as a citizen to this country? I think that will help us. For the people of MAWOGOLA, I thank you so much, because if it wasn't for you, your mandate, I wouldn't have been in the Parliament of Uganda. As a leader, I told people it's not all about serving. For so many years, I rather serve a term, but of usefulness to this country. I urge fellow leaders, please, let's look forward to giving leadership to this country, because that is the only way we can account for this mandate that people gave us. Two, we shall not be in these positions for the rest of our lives. Though, if you are at home as NAMUGGA, GORRETH, and somebody else is the member of Parliament of MAWOGOLA, will you have the moral authority to ask for service from that person if you did not make good use of the time that was given to you? I thank those leaders that have really taken on their mandate to genuinely serve their country. Thanks for listening in. Just have a good night.
Thank you so much. Remain tuned always on Smart 24 television, the only television that informs and teach, especially giving a direction on how we can change and transform our communities, especially looking at the improvement of economic livelihoods. We appreciate to have been with us on Smart 24 TV, and we continue to believe that time will come, as we're discussing this topic, when all Ugandans, especially those who are top government officials, who will behave like the late Magufuli and say, no, I will use my health service system to take care of my life, and I cannot take money. I cannot take the Tanzanian public taxpayers' money to go and search for medical attention either in USA or India. That will be a spirit of nationalism, where all of us, we are living responsibly, equitably, and loving our country. God bless you until we meet next time.